My name is Dr. Samuel Pegram. I'm a rheumatologist and I would like to welcome you to the living room, a place where we can discuss rheumatologic illnesses from the patient's perspective. Today we're going to discuss the word inflammation. I suspect that there is no more frequently used word in any rheumatology office visit than the word inflammation. I also suspect that there is not any word discussed during a rheumatology visit that has more definitions and confusion than the word inflammation. In 1964, Supreme Court Justice Potter Stewart was challenged by the court to give a description of hardcore sexually explicit literature to the court audience. Justice Stewart very eloquently said, and I quote, "I know it when I see it," end of quote. And he was right. He knew it if he saw it. I suspect if patients challenged us as rheumatologists to give them a description or definition of inflammation, a number of us would take the Stewart route. We would tell the patient, well, you know it if you see it. And to some extent, we're also right, meaning that most of us know the clinical signs of acute inflammation. But there are all kinds of inflammation. There's chronic inflammation, there's acute inflammation, there's good and healing inflammation, and then there's deleterious and chronic inflammation. So what is it that the doctor means when he tells you in the office visit that there's evidence of inflammation? If in fact a patient comes in and has hurt his knee, almost all of us know the cardinal signs of inflammation. We know that the injured area is warm to touch. We know there's swelling in the area. We know there's increased warmth when we touch the area. We know it's tender. We also know because of that, the person doesn't wish to move the extremity, so there's limited range of motion. Cardinal signs of inflammation that anybody in medicine or out of medicine knows that's the sign of inflammation. But let's say your doctor says, Mrs. Jones, I looked at your CAT scan today and I looked at your laboratory data and it shows signs of inflammation. Whoa! Now all of a sudden, that definition of inflammation is no longer valid. It's not that we know it when we see it. Do you mean that there's increased warmth in my lung? Is there redness in my lung? Do you mean I shouldn't move my lung, which may not be such a great thing if I'm trying to breathe? So the definition of inflammation changes. And so it's important for the doctor to be able to explain to the patient what type of inflammation they mean. When doctors say inflammation, most of the time they have within their mind the collection and interaction of chemical, cellular, and proteinaceous substances that collectively work together as our immune system. Those various elements work together to protect us from anything that enters our bloodstream that shouldn't be there. Viruses, bacteria, parasites, fungus, anything that's foreign that enters into the bloodstream stimulates inflammation. A protective or good form of inflammation. When these cellular elements like neutrophils and monocytes, when they collectively go to the affecting agent or the infecting agent, they gobble it up and destroy it. Proteinaceous elements like antibodies also help identify the foreign substance so the cells know what to target. Chemical elements of inflammation like cytokines and complements, they also enhance the inflammatory process. So all of those agents working together in our immune system are part of good inflammation. Inflammation is generally very prompt and acute. Acute inflammation lasts for maybe hours to days and then is gone because it effectively does its job. But when inflammation lingers, even the offending agent, the bacteria or virus, is gone, and the inflammatory process continues where those same elements, the chemicals, the proteins, the antibodies, the cellular elements now continue their work, but unfortunately begin to harm natural tissue of the host, meaning you and I, then the inflammation becomes deleterious. It becomes harmful to the patient. And we use our medicines to bring down the inflammation. So good inflammation, which is healing, bad inflammation, which is destructive. Which of these does your doctor mean when he or she says inflammation? It's also important because inflammation directs us to what types of medicines do we want to use to make the inflammatory process better. As we mentioned, there are chemical elements of inflammation, cytokines and complements. Well, some of the medicines we use in rheumatology, like the biologic agents, they target cytokines. Or if we want to attend to the cellular elements of inflammation, we may use drugs like methotrexate or cyclophosphamide. If we want to affect the antibodies in inflammation, we might use medicines like intravenous gamma globulin or IVIG. Or if we want to affect the cells that produce the antibodies, we may use medicines like rituximab. So inflammation not only is a description, but it also is a target for us as rheumatologists so that we can target our medicines to various aspects of inflammation to make the scenario better. So as you can see, inflammation is complex, and it's important for you as a patient to hold your physician and this physician's feet to the fire so that you can better understand what type of inflammation are they referencing. Good inflammation, short-acting, helpful and effective. Bad inflammation, chronic and destructive in nature, where we direct our therapy. Or clinical inflammation, the signs and symptoms, again, which we all know: increased warmth, tenderness, swelling, redness, and restricted range of motion. Always understand that inflammation, the word, is a changing target all the time. But it's important for your doctor to explain to you exactly what type of inflammation they are referencing. So when you leave the office, you have a better understanding of inflammation. The next time we get together, we're going to talk about another sometimes difficult subject, and that is the word steroids. Makes you shudder just to think about it, huh? But we're going to talk about the good, the bad, and the ugly part of steroids at our next visit when we get together in the living room. We'll see you then.